Welcome back to the Natural Balance Hoof Care Corner. If you remember, last week we treated the acute laminitis horse with styrofoam blocks, and as customary they usually get fairly comfortable with that, and we want to extend this type of support, so we're going to go to the next step by using the purple podiatry pads. And this is a system that's been developed by a good friend of mine, Mark Plumley. He uses this particular set of pads for a lot of different treatments, and it's basically a high density foam with a little sticky surface on it, and you can put these on in a variety of different ways. Today we're going to show you how to take the next step with treating acute laminitis after the styrofoam blocks have been crushed and have, for the most part, fulfilled their usefulness in this early stages. And it's been an adjunct to the whole treatment protocol, and it's become a very important part to extend the use of support to these horses before the shoes are applied, and or the clogs, whichever. So we're going to show you how to apply these. It's a means of using the impression material, the two-part putty of silicone dental impression. That's our basis of this, and then we're going to add these extra pads here to give him some added cushion. So, all right, this is how it goes. We're going to take we have an impression plate, which is a hard plastic plate. It's only used to make the mold in the bottom of the foot. We'll take this impression material, which the pink stuff seems to work the best. We have a softer material that I don't think is quite as supportive as this. And we have a firmer material, which I believe most people find is a bit too firm for this purpose here. So the pink stuff seems to be the best. We take equal parts, and we'll look at the bottom of the foot, and we have the crevices in the bottom here, and we'll use approximately half of what will fill that in each part. And so there's just a little bit more there than what we need, so we'll trim off a little bit of that, and there'll be plenty there, and we're going to trim away the portions identical to that of the styrofoam away from those painful areas. So we blend this stuff by pulling it like you would be kneading dough, bread dough, and folding it over, pulling it. It seems to blend the best that way. You try to get as many of the streaks out of it as you can. It's best applied with a complete mixture like this. Pushes in the bottom of the foot, basically in the back part, is best. The pad comes with two sizes. This is the larger side. The other side, because it's tapered this way, is a bit smaller. I've chosen to use the wider side just because it seems to fit a little bit better. Pull the tabs down, very much like the styrofoam blocks. Again, half on the plate, half on the hoof wall. Pull the hair out of the way. Tape it up if you need to. One good wrap around that. This isn't going to be on for very long, so you don't need to wrap it as extensively as we did the styrofoam. Once we've got a couple of good wraps, it's quite firm, then we'll place it down on the ground and then ask him to bear a bit of weight on that, just so that it makes a good compression. Once that side is done, we can go then to the other side, because it'll take about 7 or 8 minutes for this material to set up, and then we'll trim these pieces and put them on top of that. What I've done is taken the old impression that we've trimmed back from our first compression, and I've seen you still have the same line there, and I'm just going to duplicate that piece on here and narrow it up just a little bit to fit inside of his foot, and I'll trim that around there, and we'll put this back in his foot first over the top of the impression material, and then put another piece over the top of that. That's the sequence of this extended procedure for giving them cushion support. Okay, we've given enough time for this impression material to set up. There's generally a piece that'll fit right out the back here. You can see that's now certainly hard as it is going to be, and you can see where it's molded itself nicely to the bottom of the foot. It's firm, and we're going to trim it back to that same area that we had drawn on there before. There's the apex of the frog right there. We're trimmed just behind that. The thing that's nice about this next step is that we have, with this mold, I've taken this piece here and I've trimmed it just exactly to that form right there. And I'm going to narrow it up just a little bit. Dust this off real good. I'm going to pull this paper off here, like so. It's got some sticky stuff on it. And I'll place that right over that part of his foot there. This next part is going to stick in very much the same way. We'll take our magic marker and we'll just draw a line around the outer edge here. And right around there. And we'll trim that accordingly. We've got this trimmed back now. We've drawn around where we've drawn our line. And we'll dust that off again. We'll pull the paper from that. Again, the sticky side will go over the top of that right there. And then we'll take elasticon tape and attach this in a slightly different way, because we're going to pull this edge down as tight as we can, and we're going to pull this edge down. We're going to wrap it this way first and then come back over the bulbs of the heels. Usually one good wrap over the bulbs is adequate. We can usually get by with about a half an inch, about a half a roll of 3-inch elasticon. Go ahead and put his foot down, trim that off, pull it up here, and usually we'll take a bit of white tape and go around that. Up here. And you can see how he likes that. In fact, I can't hardly get him off of it now and get him off my apron, but went up here. And that seems to be his preference. And they can wear that now for a couple of weeks if they needs to, and they can get real active. You just have to keep adding more stuff to the bottom, more layers of elasticon or duct tape, whatever, to keep the bottom from wearing out. But it sure is a nifty way of getting them real comfortable for an extended period of time before you decide to put shoes on them. So, in a lot of horses that have minor cases of laminitis, grass founder and stuff, can get through the whole bout of laminitis very easily just on the Styrofoam and the purple podiatry pads, and you bypass the need for shoes, and they can go on and be barefooted, which is really a good option for these guys. Being barefooted is one of the best things. As long as you can act immediately, get them over the event of laminitis with whatever medications you and the veterinarian feel best, and the protection and support is of paramount importance in the earliest possible stages. Even before they become painful, that's the time to put the Styrofoam on and then graduate to this purple podiatry pads. This is the second stage of treatment of the cushion support with the purple podiatry pads. And they can go for a couple of weeks, as I mentioned before, with this, and before you decide what you're going to do as far as shoes and or being barefooted. It just depends on whether they progress from here. So these are things that, again, horse owners can do, and makes it very inexpensive to treat these horses. And I have to remind you that acting immediately is going to give you the very best results as far as treatment is concerned. It's also going to give you the best cost factors, because a lot of this stuff you can do yourself, and these parts are minimal in comparison to what a lot of things are. You'll just find it very inexpensive to deal with these problems. So again, if you want more information about this, just contact our office. They'll give you all of the instruction information and show you, and also be available to give you some counseling as well if you need to. So please get a hold of us. We're here for you, and we would want you to deal with your laminitis cases in the best possible way. It's not that this is perfect or that we have all the answers, but boy, it sure has been a step forward in getting a lot of these horses through some of these real crucial times. It's a lot easier to treat laminitis in the earliest stages like this rather than deal with them when they have marginal coffin bones left and things like that. So get ahead of the game, get ahead of the curve, and we'll be there with you through this whole bout. Thanks very much.